Welcome to part 2 of the Stress Less series. In part 2, we will enhance our awareness about stress. To manage stress more effectively, we must first understand the potential stressors in our life, the negative consequences that result from these stressors, and the seriousness of these consequences. To understand stress and its consequences, we must identify both the acute and the chronic signs and symptoms of stress. Acute stress is the short-term stress, whereas chronic stress is long-term. We must identify our potential personal stressors, and we must recognize the importance of changing some of our behaviors. Some of the acute signs of stress, as you recall from part 1 of the series, include anxiety, an increase in blood pressure and heart rate, an increase in our stomach acid, dry mouth, cold and clammy hands, and an increase in perspiration. Take some time now to reflect and to discuss within your group the changes that you have noticed after a stressor has affected your body. These are some of our body's reactions to acute stress. Again, take time to reflect and to discuss as you feel comfortable any that you may be able to relate to. Whereas acute stress is short-term, chronic stress is long-term. As you can see here, this list is quite extensive. Please pause this video now to reflect and to discuss how you react to chronic stress. Do you suffer from chronic stress? Pause this video now to take a few moments and find out. And if you have these symptoms and they persist, please seek medical attention. One helpful tool to find out how we respond and react to stress is by keeping a stress awareness log. It is basically a daily record of our stressors and how we react to them. By keeping a daily log, like the one shown here, we can rule out symptoms that are unrelated to stress, as well as establish a baseline to help develop goals in reducing stress.